Go right into this to this last story now that we had our sad news, and this
let's pick the mood up a little bit.
Yeah, I have some good news. A good news to end the show with you guys on. 3 conditions for which cannabis appears to help. The utility of cannabinoids to treat most medical conditions remains uncertain at best, but for at least 3 indications, the data lean in favor of effectiveness. Elise Grossman, MD, MPH, told attendees recently at the 2024 American College of Physicians Internal Medicine, those are neuropathic pain, chemotherapy-induced nausea or vomiting, and spasticity in people with multiple sclerosis, said Grossman, an instructor at Harvard Medical School in Boston, Massachusetts, and medical director for primary care behavioral health integration at Cambridge Health Alliance in Somersville, Massachusetts. Research is sorely lacking and of low quality in the field for many reasons, Grossman said, most of which the products tested come from outside the United States and are often a synthetic and taken orally, which does not match the real weed use when patients go to dispensaries for cannabis derived directly from plants or the plant product itself, and studies often rarely rely on self-reporting. Chronic pain is by far the top reason they say they use medical cannabis, Grossman said in a Cochrane review of 16 studies found only that potential benefits of cannabis may outweigh the potential harms for chronic neuropathic pain. Grossman said she is frequently asked if cannabis can help people quit taking opioids, and the answer seems to be a no. A study published earlier this year in states with legalized medical or adult use cannabis found no difference between rates of opioid overdose compared with states with no such laws. It seems like it doesn't do anything to help with our opioid problem, she says, and nor does high quality evidence exist showing use of cannabis can improve sleep, she said. A 2022 systematic review found fewer than half of the studies showed the substance was useful for sleep outcomes. Where studies were positive, it was in people who had chronic pain, Grossman noted. Research indicates cannabis may have substantial benefit for chronic pain compared with placebo. And in some of the potential harms, she notes that if the medical benefits of cannabis are murky, the evidence for its potential harms, at least in the short term, are clearer, according to Grossman. A simplified guideline for prescribing medical cannabis in primary care includes sedation, feeling high, dizziness, speech disorders, muscle twitching, hypertension, and several other conditions among the potential hazards of the drug. But the potential for long-term harm is uncertain. All the evidence comes from people who have been using it for recreational reasons, where there may be co-use of tobacco, self-reported outcomes, and recall bias, she said. The characteristics of people using cannabis recreationally differ from those using it medicinally. And use with other controlled substances, Grossman said clinicians should consider whether the co-use of cannabis and other controlled substances such as benzodiazepines, opioids, or Adderall raises the potential risk associated with those drugs. Ultimately, it comes down to talking to your patient, she said, and if a toxicity screen shows the presence of controlled substances, ask about their experience with the drugs they are using and let them know your main concern is their safety. Grossman also reported no relevant financial conflicts of interest in regards with this report, you guys. I can't wait to hear what y'all have to say about this.
I mean, they're saying that it helps with neuropathic pain and MS, but they're saying that there's no signs that it helps pretty much anything else. It's just a case by case. Like, so I mean,
I feel like it's a good start because at least they admitted some good things, even though they're trying to rebuke others that most people. So it's like once you start getting those first couple concessions, then you can get into getting more. And most people already know that cannabis helps them with sleep, or most people are helped with cannabis.
I'm glad to see more and more of these studies coming out, chipping away at that glass ceiling, as you're saying, Jason. Yeah, it's I guess we'll take any positive news in the right direction. But, you know, here's where I believe, you know, we can use the prohibitionists' stance against them too, and to actually get better research on the opioids that they've approved, right? Like, why don't we talk about that? What are the positives that have come from any Alzheimer medicine? None. There's 5 on the market right now, and none of them have any positive results at all. Like, none of them have ever shown to help with anything tied to Alzheimer's, but they are all FDA approved. Like, why can we not get cannabis approved better, right? Or quicker?
Well, we all know the reason for that, Rico.
Money.
Yep.
Money.
Well, and Alzheimer's too is like, you know, I don't want to go down the rabbit hole, but I mean, like, obviously there's a correlation with Alzheimer's and, you know, our food supply and how it's changed and how many more, you know, people have been diagnosed with Alzheimer's based on that. And the list goes on. Obviously, natural medicine has gotten shat on by the petroleum industry and the pharmaceutical industry for a long time, just because they put their products in those products that they feed us. And the mere fact that, you know, our whole entire like nutritional system is just corrupted from the bottom up. It's leading to a kind of resurgence of the natural medicine. But of course, if we just keep going, it's going to also be corrupted yet again. So, you know, natural medicine obviously is a choice. People have to really choose to just live a healthier lifestyle. A lot of things get better when you do, and when you use natural medicines instead of pharmaceutical medicines. Not that I'm saying, you know, to do that or switch your medicines out there. For anybody watching, consult your doctor. But if you have a choice, then you need to probably take that seriously.
You know, what's challenging for me is they said that that recreational cannabis didn't have an impact on opioid uses in states as measured by opioid overdoses. And what comes up for me is the way in which data can be skewed based on the parameters that you create. And so I would think that somebody banging that Harvard drum would understand that if you only measure opioid overdoses, you are not getting a complete picture of opioid use in a certain state. You are not counting the number of users. You are not counting the number of people who are abusing it. There are a variety of metrics that could be used to get a more granular understanding about whether state legal recreational cannabis programs do have a positive impact by reducing opioid use in residents of those states and opioid-related health issues. And if all you do is measure overdoses, there is an argument to be made that a small group of opioid users who are addicted are not going to be able to be cured or have that addiction mitigated through cannabis use, and that those opioid deaths are going to remain a static number. And so I'm just a little frustrated that that was the metric that they chose, because I think there could have been an opportunity to create a greater, more detailed level of insight.
Interesting.
I mean, they could have gone with ER visits, the amount of Narcan that's used by emergency medical technicians, the amount of people going into drug diversion for opioids. There's just a million different ways that they could have chosen to do a better job of measuring. And if all they do is deaths, that just seems like a lazy approach.
Exactly. I agree.
These comments, keep these comments coming. Keep these comments coming in on where Yarrow is driving to.
Yeah, exactly. He's just on the road driving up the 101.
Yarrow's got 2 tickets to paradise.
Yeah, Yarrow's looking more in the rearview mirror trying to make sure that the CHP ain't pulling up behind him.
Pulled over.
Yeah.
I am not on the 101. I am on the road to redemption through my participation with INI News. I am driving the wine.
He's on the road to perdition.
That's right. I'm driving through the wine country, went from Sonoma past Napa on my way up to Browns Valley for a real estate assignment.
Mm-hmm. A real estate assignment.
Yeah, make sure no left turns.
First grade.
Yeah, no left turns without
first grade for Yarrow.
Stopping first.
He's got an assignment.
I'm going up to a ranch. We're gonna sell a ranch, and so I'm gonna spend my afternoon hanging out with horses.
So do the horses come with a ranch?
I like to say everything is negotiable.
All right, fair enough. Fair enough. If you want to buy some horses, Yarrow has somewhere to stable them at, apparently.
Yarrow Kubrin, hanging with the horses.
Yeah.
Horses are cool. They're really cool.
Let's wrap it up.
Basketball stud. On that